Hello everyone, welcome back to my channel Oral Health Management by dr.Alka Khade. Last time we discussed about thumb sucking habit. Today we are going to discuss about tongue thrusting habit. Tongue thrusting habits many children and adults are having. What is a tongue thrusting habit? It is a condition in which tongues comes in contact with any teeth anterior to the molar, that is ahead of the molar, that is premolar, central incisor, lateral incisors and canines while swallowing. Tongue thrusting is a forward placement of a tongue in between the anterior teeth and against the lip while swallowing. Now what is tongue thrust? Tongue thrust appears when the tongue presses forward too far in the mouth, resulting in an abnormal orthodontic condition called an open bite. You can see in the picture. This condition is most common in children. It has a myriad of causes including poor swallowing habits, allergies, tongue tie. Now we'll see the tongue thrust in babies. In babies who are breastfed or bottle fed, tongue thrust is normal. As the child gets older, their swallowing and speaking patterns normally evolve. However, some type of bottle nipples and pacifiers and prolonged use of bottle can lead to an abnormal tongue thrust that lasts past the child stage and into early childhood. There are several other potential causes for tongue thrust that begin in infancy. Some of these includes long-term sucking habits that influence the tongue's movement, like sucking of the thumb that we saw last time, fingers or tongues, allergies accompanied by chronically swollen tonsils or adenoids, tongue tie, where the band of tissue beneath the tongue is tight or short. The last is a swallowing pattern known as reverse swallow. In children's, tongue thrust is apparent when there is too much forward movement of the tongue during swallowing and speaking. Most often the tongue tends to push forward in the mouth. You can see in the picture. Sometimes the tongue presses into the back of the teeth. Tongue thrust has a number of telltale signs that manifest in children who have developed the pattern. These can include the tongue is visible between the teeth. The tip of the tongue sticks out between the teeth, whether the child is resting, swallowing or speaking. The second is mouth breathing. The third is inability to close the lips completely. This could be due to structural abnormality or habit. Now the open bite is. Open bite occurs when the front teeth don't meet when the teeth are closed. Then slow and fast or messy eating. Last is speech impediment. Lisping of S and Z sound is common. Now we'll see the tongue thrust in adults. You can carry tongue thrust forward into adulthood from untreated childhood habit or issue. If you are an adult with a tongue thrusting issue, it could have developed because of chronic allergies or swelling of the adenoid or tonsils. Stress may also be a contributing factor. There are reports of tongue thrust developing later in life, but it is not common. Now, how is tongue thrust diagnosed? A number of different healthcare professionals can diagnose tongue thrust, including general practitioners, pediatricians, speech language pathologist, dentist, and last is orthodontist. You or your child's doctor may observe the way you speak and swallow. Some practitioners may evaluate swallowing pattern by holding down the bottom lip to watch how you and your child swallows. Specifically, your doctor will want to see where the tongue is placed when swallowing. It is possible that other related medical professionals become involved in the full pattern of diagnosis of tongue thrust. For example, your child pediatrician might make the initial diagnosis, but then your child may need to be evaluated by a speech language pathologist, an orthodontist, an ear, nose, throat specialist, that is ENT surgeon, or gastroenterologist. Any professionals who can lend their expertise to the cause of symptoms of your child's tongue thrust will become part of their treatment team. Now the question is, can tongue thrust cause other condition to develop? Left untreated tongue thrust can cause malformed teeth, that is misalignment of the teeth. When the tongue pushes against the back of the teeth, the pressure can make your front teeth move forward. This creates a gap or open bite between your middle top and bottom teeth. Untreated tongue thrust can lead to a long-term damage to speech, like a lisp over certain sounds. It can also cause your facial shape to elongate and your tongue to protrude from between your teeth. Now the treatment part. How the tongue thrust treated. Treatment for tongue thrust tends to be similar between children and adults. One exception is the placement of an orthodontic device known as tongue creep in the roof of a child's mouth. This corrects an open bite. In some cases, adults receive orthodontic treatment as well. Generally, orthodontic devices can offer good treatment. Work with your dental professionals to find the best treatment for you. Sometimes the recommended treatment is orofacial myology. This is an ongoing therapy that corrects the placement of the lips, jaw and tongue. The therapy addresses swallowing habits too. Correlations made to open bites without ongoing therapy have been observed to reverse themselves over time. Now the question asked by the patient, can anxiety causes tongue thrusting? Anxiety state. The anxiety state can be acute or chronic. Rubbing and thrusting of the tongue against the teeth occurs as a manifestation of anxiety in the tense, apprehensive, pent-up individual. It occurs particularly when the person is subject to emotional stress. Now the one important questions. What is the outlook for people with tongue thrust? The answer is tongue thrust is a highly treatable condition. A full recovery can be made if you commit to attending the appropriate therapy session your doctor recommends. You may also need to address other underlying health conditions that contribute to your tongue thrusting. Once those conditions are treated and you stick to your treatment plan, tongue thrusting should resolve over time. So friends, make sure your tongue is pushing against the gum. Next is keep your teeth together and keep your lip apart. Lastly, while swallowing, make sure to keep your teeth together and keep your lips apart. Performing this exercise 2 times a day, that is morning and in the evening, can stop your tongue thrusting habit in a track. So friends, many are having tongue thrusting habit. Do visit your dental clinic because he is the right person to guide you. See you soon with the next video. Till then, bye-bye. Thank you.